Ladies and gentlemen, put your hands together for our esteemed Sri J.P. Nadda, Union Minister for Health and Family Welfare, Government of India.
Vasudhaiva Kutumbakam, an ancient Vedic thought which means world as one family, is the basic principle at Symbiosis International University. It is clearly seen in the culture of all Symbiosis students who not only come from all over the country but from all over the world. We don't just coexist, but we work together in a way that benefits each one of us. I guess that indeed explains the word symbiosis and also our university, which we proudly represent.
One race, many cultures, one place. Good evening, guests, delegates, and everyone present here today. I, Anmol Meghnadhan,
And I, Himanshu Mishra,
students of MBA, Hospital and Healthcare Management Program from Symbiosis Institute of Health Sciences, on behalf of Symbiosis International University, welcome each one of you to SYMHEALTH 2017.
the Faculty of Health and Biomedical Sciences, Symbiosis International University has organized SYMHEALTH 2017, International Conference on Healthcare in a Globalizing World. The objective is to explore enriching healthcare delivery through an interdisciplinary approach.
I am sure your experience at SYMHEALTH is being productive and fulfilling. With the same enthusiasm, let us all proceed towards inaugurating it with zest and zeal. As we begin, let us take a walk down the memory lane to trace the humble beginnings of the Faculty of Health and Biomedical Sciences to its greatness today. Here, we bring to you our story in a short film.
Significant things have humble beginnings.
I hope you all found the film interesting and enjoyed it thoroughly. To initiate the proceedings, may I request Dr. Rajiv Yeravdekar, Dean, Faculty of Health and Biomedical Sciences, Symbiosis International University, to accompany our esteemed dignitaries to grace the dais. Ladies and gentlemen, may I request you to put your hands together to welcome the esteemed chief guest for the inaugural ceremony of SYMHEALTH 2017, Sri J.P. Nadda, Union Minister for Health and Family Welfare, Government of India.
Honorable Chancellor, Symbiosis International University, Dr. S.B. Muzumdar, Founder and President, Symbiosis.
The two charming ladies at leadership positions at Symbiosis, Dr. Rajni Gupte, Vice Chancellor, Symbiosis International University, and respected Dr. Vidya Yeravdekar, Principal Director, Symbiosis. To grace the dais, we also have with us Dr. Jyoti Chandiramani, Dean, Faculty of Humanities and Social Sciences, Symbiosis International University.
Dr. Aparna Hebbani, Dean, Faculty of Media, Communication and Design.
Dr. Shashikala Gurpur, Dean, Faculty of Law.
Dr. T.P. Singh, Dean, Faculty of Engineering.
Dr. Dhanya Pramod, Dean, Faculty of Computer Studies.
Dr. R. Raman, Faculty of Management.
Professor Ruchi Jaggi, Director, Symbiosis Institute of Media and Communication.
Professor Shivali Lavale, Director, Symbiosis School of International Studies.
Dr. Lalit Katpalia, Director, Symbiosis Institute of Computer Studies and Research.
Dr. Arvind Sinsore, Chair Professor, Symbiosis Center for Entrepreneurship and Innovation.
Dr. Yogesh Patil, Professor and Head, Research Publication, Symbiosis Center for Research and Innovation.
Dr. Abhay Saraf, Organizing Secretary, SYMHEALTH 2017. Honorable guests, we welcome you all today.
SYMHEALTH 2017 conference offers unique opportunities to experience cutting-edge technology and innovative blend of ideas. It is a melting pot for global multidisciplinary healthcare services coming together, sharing a concern and passion for improving quality and safe healthcare delivery.
We have with us Dean, Faculty of Health and Biomedical Sciences, Symbiosis International University, Dr. Rajiv Yeravdekar. Sir, known for his brilliance, quick-wittedness, and dashing personality, graduated from the prestigious BJ Medical College, Pune, securing top honors in general surgery, obstetrics, and gynecology. Sir has been awarded PhD under the Faculty of Management by Savitribai Phule University, Pune. Dr. Rajiv, sir, has primarily been ex-member of the Board of Governors of the Medical Council of India and currently is a member of various governmental bodies like Maharashtra Medical Council, Maharashtra Nursing Council, and many more. May I request Dr. Rajiv Yerodekar, sir, to address the audience.
Good afternoon, everyone. Chief guests of this inaugural function of the 18th edition of SYMHEALTH International Conference on Healthcare in a Globalizing World, the theme of which is to foster healthcare delivery through an interdisciplinary approach, the Honorable Union Minister for Health and Family Welfare, Government of India, Shri J.P. Nadda ji, the Honorable Chancellor of Symbiosis International University, Dr. S.B. Muzumdar, sir, the Vice Chancellor, Dr. Rajni Gupte, madam, Principal Director, Dr. Vidya Yeravdekar, my colleague deans of the various faculties under the Symbiosis International University, eminent dignitaries seated in the audience, and I can spot Dr. Mohan Agash, sir, my teacher, Dr. Nikhil Datar, Dr. Sangam Nerkar, and many others, Professor Devre, and many others whom it would not be possible to name for paucity of time. Well, friends, the Faculty of Health and Biomedical Sciences has been conceptualizing or thinking of this conference for the last 1 year. And for faculty members, you may recall, that was the 6th of May 2016 that we declared that in May 2017, we would have this edition of SYMHEALTH. The objective was to explore, invent, initiate dialogue between various stakeholders of the healthcare sector. Nadda ji, we have been doctors. I'm a gynecologist by training. And I realized that we healthcare professionals, whether doctors, nurses, or paramedics, tend to work in their own ivory towers, in their own silos, choosing to be blissfully unaware of the developments and advancements in other disciplines which ultimately impact healthcare delivery to the common man, be it healthcare laws, be it healthcare communication strategies. And we had a very interesting session going on just prior to this session, sir, where he spoke about the importance of communication skills with doctors. And as a former member of the Board of Governors of the Medical Council of India, we had put in place a document seeking to mandate communication skills training for medicos in training. From the various policies implemented by the Union Ministry under the able leadership of Nadda ji, the National Health Policy document is indeed a landmark judgment, or a landmark document, which seeks to provide affordable and equitable healthcare, especially to the marginalized sections of society. The conference, therefore, is in a way different. And what distinguishes this conference is evidently visible. A, the approach, and none of the gentlemen and ladies sitting here other than Dr. Vidya are medicos. So we want to establish a rapport and talk to the stakeholders beyond medicos. We understand that healthcare is beyond hospitals. It is beyond medicos. We need to talk to the economists. We need to talk to the lawmakers. We need to talk to the technologists. We need to speak to the IT guys who provide healthcare solutions which make healthcare replicable across the various states and countries of the world. We need to interact with diplomats to understand how healthcare is a soft tool to foster diplomacy and cement international relations. We need to understand innovations and entrepreneurships. And talk as you may about the developments in healthcare globally, we need to understand that healthcare in India is a different ballgame altogether. Our ancient system of Ayurvedic medicine, homeopathy, Unani, and yoga above all, are here to implement and impact healthcare delivery. So this is the first interdisciplinary conference held so far in the country, sir. And I say this with conviction because typically as clinicians, we have conferences dedicated to mainstream medicine. We talk about advances in therapies in medicine, in diabetes, tuberculosis, hypertension, cardiac diseases, stroke. Not that that is not important. And usually in these clinical disciplines-oriented conferences, these important topics are given peripheral sideline importance. This is probably for the first time that they've been brought into mainstream, as Dr. Mohan Agashe says, from art cinema into commercial cinema. Students would be hearing your address, sir, from campuses of Symbiosis at Noida, Bangalore, Hyderabad, and across various campuses within Pune, one of which you would have probably seen as you touched base at Pune Airport. We have stalls and pavilions to showcase innovations and entrepreneurial initiatives. We've got a concept of a marketplace where we have invited civil society organizations and non-governmental organizations to show their services and products. And most importantly, sir, we have very strongly and emphatically eschewed from getting any sort of support from pharma companies. Typically, medical conferences are supported by pharma companies or medical equipment devices manufacturing companies. So you will not see a single stall from any pharma company or from a medical equipment devices producing company. But there are stalls which showcase the impact and societal bearing of various healthcare services, including the societal initiative started by Symbiosis International University called SCOPE, which you just heard about in the previous session. So the way forward after this conference is to bring about a compendium. Typically, again, conferences come out with questions solved and what are the opinion of experts. Yes, we would be doing that. But more importantly, we would be coming out with a compendium of questions unanswered. Because we do understand that healthcare has a lot of questions which cannot be solved in 2 days. It's far too complex to be solved over 2 days and more so over the fag end of the week. And we do understand and appreciate that solutions would evolve over a period of time. We would dwell on the future of healthcare, what new jobs would be created, as our Honorable Chancellor said, what new skill sets which we would be required to adopt, ingrain, how are we healthcare professionals going to sharpen our axe, so as to say. And obviously, the thrust and focus on evidence-based research is always the bottom line at any of the academic initiatives of Symbiosis. And this conference has attracted a whopping number of 463 abstracts and 156 full-length research papers, which would go for publication in index journals. So all in all, exciting times, inflection time for the development of faculty of health and biomedical sciences at the university as we sit on the threshold of our hospital and research center being commissioned in a year from now. And under the able and dynamic leadership of the Union Health Minister, we are confident that healthcare will be undergoing a transformative change in the years to come. Thank you, ladies and gentlemen.
Thank you, sir, for your valuable insights about SYMHEALTH and making us understand how healthcare has its impact on the common man. It is indeed a privilege to have amongst us today Principal Director Symbiosis, Dr. Vidya Yeravrekar, who holds a postgraduate degree in medicine, a degree in law, and has earned PhD in internationalization of higher education in India. She has been a member of University Grants Commission and Central Advisory Board of Education and Indian Council for Cultural Relations. She is a member of governing board of several organizations like...
It's quite awkward to listen to your own CV in front of such august gathering of people. The chief guest for this inaugural ceremony, Dr. Nadda sir, the Chancellor of this university, Dr. S.B. Muzumdar sir, the Vice Chancellor, Dr. Rajni Gupte, Dr. Rajiv, my colleagues from various faculties who are on the dais, Mrs. Muzumdar, my various professors when I was in BJ Medical College, the very renowned professor of psychiatry, though I didn't attend many lectures of yours, sir, Dr. Mohan Agashe, Dr. Sanjay Gupte, Dr. Sangam Nerkar, and many other eminent dignitaries in the audience. Sir, we are very glad that you accepted to inaugurate this very prestigious interdisciplinary conference in health sciences. In fact, it's been quite some time that we've been requesting Dr. Nadda sir to visit Symbiosis, but of course this was the best occasion that we could have invited him, not just to showcase the work that we are doing through a film that was shown to you, sir, but more importantly to inaugurate a conference where 1,300 healthcare professionals, including doctors and other professionals from other areas of healthcare, have gathered here on the Symbiosis campus. And let us applaud to all these people who are sitting in the audience. Sir, they've come from very faraway places, many of them even from foreign countries. And it is a wonderful mix of academicians, of practicing doctors, of practicing professionals, and I think more importantly, I can even see students in the audience. I wish when I was a medical student at BJ Medical College that we ever could attend a conference like this, which actually looked at healthcare from various disciplines and various angles. I think we would have been better people, more knowledgeable in various domains than just having a tunnel view to treat patients. Sir, this morning I was amazed when I attended one of the sessions on healthcare communication. And I felt that that was so very important that during the medical curriculum, if we were taught how to communicate with patients, I'm sure it would have solved many medico-legal problems that exist today in our country and where doctors and my own colleagues in my profession face. I think such subjects are of great importance, and some of the universities, medical universities, have introduced them in the curriculum, but I hope that it is made almost compulsory in the medical curriculum, whether it's the MBBS or the Ayurveda or, for that matter, the homeopathy curriculum. I think doctor-patient relationship is based on communication, and it's not just about faith and trust, but I think how you communicate with your patients. Sir, we have an ambitious plan. You've seen the film and you've seen that we focused not on establishing a medical college. In fact, one wonders when Rajiv and me are medical doctors, why shouldn't Symbiosis have established a medical college by now? But there were several reasons, and now with this present government and of course with the present dynamic minister who's brought in so much of transparency and ethical practices, we hope that one day even Symbiosis sees a medical college on its campus. But nevertheless, as healthcare professionals ourselves, we felt that as much as India requires doctors, India requires more technicians, technologists, and nursing professionals. And therefore, we focused on areas that other universities never even looked at, because their objective was different, and our objective is to actually produce human capacity and a human resource, not just for our country, but for the world at large. If you would have seen in the film, sir, for the nursing course, and even for the course in medical technology, we have several international students, specifically students from Africa. So we get a lot of students on scholarships from various African countries. Many of them come on their government scholarships, and to many we provide scholarships, almost some of them even almost fully funded by the university. Because we believe that if we train them and build capacity,